Okay, these are my supplies that I'm going to use for my central venous blood draw. I'm going to have here my 2 blood draw vials. I have my safety gauge needle, my extra access ports. I have my biohazard bag, my hand sanitizer, my biohazard container. I have my alcohol prep on the side, my gloves, 2 ml syringes filled with normal saline, and my 1 empty 10 ml syringe, and it's sterile. I'm going to enter patient's room now. Knock, knock, can I come in?
Yes.
I'm going to take my supplies inside, provide patient privacy, perform hand hygiene, ensure that there is environmental check, make sure that the patient's bed rails are up, side rails are up, that the patient's bed is locked in place, that the oxygen tank is turned off, and I'm going to raise the bed for proper body mechanics and place it at waist level. Hi, my name is Smrtha. I'm going to be your RN for today. Can you verify your full name and date of birth for me?
Chris Taylor, March 26, 1990.
Okay, thank you, Mr. Taylor. So your doctor has ordered for me to take a blood draw out of your central venous device. Is it okay if I do that today?
Yes.
Okay, I'm going to verify the doctor's order. So I'm going to verify his full name and date of birth again. Can you do that for me?
Chris Taylor, March 26, 1990.
Okay, so I have the order here. So I have the correct patient, medical record number the same, and the doctor has ordered a CBC and electrolyte panel stat today by Dr. Lopez. So the correct order is here. I'm going to perform hand hygiene. I'm going to place my gloves on. And patient has already been disconnected by any infusion lines in the IV. I'm going to ask the patient, do you have any pain right now in the area?
No.
Any tenderness right now when I touch the area?
No.
Okay, and I'm also looking for signs of infection, for any erythema, any discharge or swelling, and the site has not been noted, so it's okay to go. So I'm going to start by grabbing the ports, and I'm going to use the alcohol swab to clean the area for 10 to 15 seconds. And I'm going to let it dry, and I'm going to use my 10 ml syringe with normal saline connected to the ports, and I'm going to withdraw some blood from the ports, but I'm not going to allow it to enter the syringe. I do see patency, so I'm going to go ahead and start flushing the ports, and I'm going to use the pulsating method all the way through. Once I'm done and I reach the end, I'm going to withdraw blood, and this is going to be discarded because we don't want it to contaminate our vial. So I'm going to throw this away in our biohazard container. I'm not going to let it go. I'm going to just grab over my 10 ml sterile syringe, and I'm going to connect it. It's still sterile, so I can still connect it in. And here I'm going to withdraw the blood that I'm going to use for my blood sample. And I'm done collecting. I can let go now. And I'm going to use the blood that I have withdrawn and connect it to my safety gauge needle. Connect it here on this side. Using this side down, I'm going to grab the vial and I'm going to insert the blood into this vial. So that's one vial, and then I'm going to enter the next one. Okay, and now I'm done with this, so I can discard this in the biohazard container. And I'm done here. I'm going to go back to my ports. I'm going to hand it over, and I'm going to clean it again for 10 to 15 seconds because it's already been contaminated. The site needs to be cleaned again. So I'm going to let it dry, and I'm going to go ahead and flush it again with the 10 ml normal saline connected to the ports. And I'm going to use the pulsating method all the way through. And I'm ensuring that there is patency in the port. I'm going to throw this away in the biohazard container. Some facilities, it require for you to change the port, so I'm just going to connect it here. It's already clean, so I can clean it. And I'm going to connect the patient back to the IV. So I'm going to clean this for 10 to 15 seconds and allow that to dry, and the patient will be connected back again to the IV. I am done with that portion. I'm going to do hand hygiene. I'm ensuring that the patient's side rails are up, the patient is back at the bed is lowered and the bed is locked, and I can go ahead and start with my blood vials and making sure that I have the patient's correct name, date of birth, and the order. And I'm going to label here today's dates, the time that it was taken, so 4:45 p.m. and I'm going to put in here that it was in the sites central venous device, and I'm going to initial. So this would be on the vial of the blood draw. PM, so central venous device, and this will be in here. Once I have this done, I can go ahead and place this in the biohazard bag. So here it is. Gonna put in my 2 samples, and this will be taken out to the lab, and I can perform hand hygiene, and I am done. Thank you.